The inescapable conclusion is that the rate of infection is going up. It is spiking. The apex is higher than we thought, and the apex is sooner than we thought. That is a bad combination of facts. So slow the spread. We'll still keep doing everything we can, but it is clear that we must dramatically increase the hospital capacity to meet that highest apex. And we have to do it very quickly. Again, the apex could be here in as little as 14 to 21 days. And you're talking about a very significant logistical, operational movement to increase that number of hospital beds and do everything that you need to do related to the increase in hospital beds. There are three elements that are necessary to increase the hospital capacity. First are obviously the availability of the beds. A bed without staff is virtually useless, and a bed and a staff without the right equipment is virtually useless. So you have to complete all three at the same time.
Chances are, even though we flatten the curve and we work out of it and we're bringing industry back on, there's the potential until we get a vaccine or a cure that it's going to tick back up at some point. So we have to take that into consideration when they're making these recommendations. I'm going to base my recommendations on what I'm seeing in the state of Iowa based on the data that I have, but one of the elements that we look at is what's happening in other states across the country. So at least twice, if not 3 times a week, I have the opportunity to jump on a call with governors from across the country at least 1 time a week. That includes the vice president and often the president. So we can get an up-to-date overview of what's happening at the federal level, things that we need to be looking for and taking into consideration some of the data that they're seeing in states that have really become hotspots, and then to have the opportunity to talk with governors and find out what their what the metrics they were using and what did they use, what kind of criteria to make some of the decisions they made, when and how is just helpful. But you have to take a look at your own population.
We're all taking different steps based on what we think is right for our states. These are all things that you've been talking about to try to bend this curve downward and to stop this overflow crush on our healthcare system. I'm going out today with the National Guard to stand up a 250-bed hospital in the Baltimore Convention Center to try to help with this surge, and we're all fighting it this thing as best we can from all directions. But we're just trying to take the best advice we can from the scientists and all the experts and making the decisions that we believe are necessary for our states. We don't think that we're going to be in any way ready to be out of this in 5 or 6 days or so, or whenever this 15 days is up from the time that they started this imaginary clock. Most people think that we're weeks away from the peak, if not months, and that's what the advice we're getting from the smart folks at Johns Hopkins and NIH and University of Maryland and places like that. Unless you have an essential reason for leaving your home, we want you to stay in your home. We are closing all of those businesses that are not absolutely essential. We've closed the schools, and we think it's absolutely critical that everyone be a part of this breaking the back of this virus so we don't infect hundreds of thousands more people in our state and we don't have thousands of deaths. We just had a big spike in the past week. We're up about 600% over the week before, and there's no time, we're going up, we're not going down. And this is not over by any stretch of the imagination, and we need everybody at the federal, state, and local level of government, the private sector, and every individual to help us fight this battle.
Anybody who's been traveling out of state, we very strongly recommend that they again take that very seriously. They self-isolate. It's kind of a message that started a few weeks ago when the university system was looking at the concept of spring break and students possibly coming back. They put a stipulation of anywhere with more than 100 cases. At this point, we just want anybody that has been traveling out of state, out of their community, and into areas where they don't normally travel, to again take that self-quarantine very seriously. It's going to be a big effort. And again, we're really trying to elevate the message here. People have to take this seriously. We've seen the people of New Hampshire respond very, very well. But we want to make sure folks understand we are in this for the long haul. This isn't just a week or 2 weeks, as the commissioner mentioned. The surge could happen 3, 4, 5 weeks. We don't know when it's really going to hit its peak. So until then, we have to be very, very vigilant about our personal responsibility with our businesses, with who we interact with, and take the concept of isolation very seriously. And if I may also The fact that we are now going to be tripling over the next day here or so, we're tripling the number of tests that the state is able to do, and that's an amazing opportunity we have at the state. So I think the commissioner would agree that we're going to see a huge surge in the number of reported cases of COVID across New Hampshire in the next couple of days. That is absolutely expected because we're simply getting much better at identifying these individuals, and will allow us to, again, isolate those individuals much quicker, get them out of make sure they are isolating and getting them out of their contact system. And that, again, helps really suppress the potential surge. So there will be a surge here. It's all about making sure that we can suppress it to the level that we manage and don't overrun the healthcare system.
These are not easy decisions because they will be painful for many people. But every decision we make is based on science and data. And as your governor, I take full responsibility. The feedback I'm hearing from Virginians is supportive. You understand that while these changes are difficult, they are necessary. You understand that we are fighting a biological war, and to have economic recovery, we must get through this health crisis first. That doesn't make these sacrifices any less painful. The world has no doubt changed. This will be our new normal for a while. As I've said, months, not weeks. And we need to understand that. But it won't be forever. We will get through this. We are working every day to ensure that our hospitals and medical professionals have the equipment they need to do their jobs. I am a physician, and our Secretary of Health and Human Resources, Dr. Dan Carey, comes from a large health system. We are in frequent contact with our medical providers to talk about their needs and how we can all work together to meet them.